This is Dr. Yates in Chicago with one of my favorite patients, Neil.
Hi, I'm Neil.
Okay, and what I wanted to just go over, Neil's having a second procedure, but he had his first procedure approximately a little over a year. He had 3,000 grafts. And a lot of people will say, well, that's a lot of grafts, and that is, and it's all dependent on what you need. And you're going to see from Neil's pre-op pictures that he didn't have much hair. So I want to show you this picture. Neil, is that you? Or?
Oh, that's me.
Okay, so we're not playing a trick game here.
No.
Can you see this picture? No. So you can see that Neil was what we call a class 6 as far as, hair loss. He didn't have any hair from the hairline all the way to the crown. Okay, and now take a look at his hair now. He has nice combable hair through the front, through the mid scalp, and we kind of sprinkled some through the vertex. You don't want to really spend a lot of time, I think, in the vertex because you get diminishing returns because that area is so prone to changing dimensions. So you want to spend most of your time on this front and this mid scalp to give a good frame of the face. So Neil, has anyone said anything like, well, you look different, you got hair, or you're the handsomest man in the world, any of those?
Oh, I've heard it said that you gained a lot of years back, guy.
Okay.
Like, thank you much.
Gained a lot of years back, meaning that you went back in time, not forward.
Correct. Yeah, they say, man, you look like you're about 16, 17 years younger than you were.
Very good, very good. So now, did you tell people you had a hair transplant?
I sure did.
Okay.
I was as public as anybody would want to ask about it.
Okay. Did you ever talk to any other men that had thinning hair about a hair transplant?
Yes, I have.
And what were their thoughts? Because what I'm asking is because a lot of men, of course, I go, you walk into work, I see millions of people who can benefit from hair transplantation, and being a patient myself, I know how much losing hair bothers people. Why do you think men don't just pull the trigger and just do it? Given the results. Your results are natural. You had the ARTAS robotic system, and I did some manual FUE as well. I mean, nobody, even with a trained eye, could say you had a hair transplant. The back of your hair looks absolutely fabulous. You could shave it. You won't have a big stripe in the back like, a lot of people do. So what's wrong with guys? What do you think, why do you think we're hesitant to do this?
I would tend to say it's maybe a good part of it would be fear of the unknown.
Mm-hmm.
Like, how much pain is this going to be?
Well, address pain. Did you have a lot of pain?
I myself did not, fortunately.
Okay.
Whatever pain I had was minimal. The medications I was given, I didn't even have to take any.
Wow.
So that worked out well for me.
Okay.
And
they're afraid of pain. What else are they afraid of?
Possibly too, thinking, oh my gosh, I really don't think I'm as old as I look. I mean, I think people maybe tend to underestimate what the hair loss can do, and you're going to need the opinion of somebody else to say, this wouldn't be a bad thing, especially if you want to climb the corporate ladder. People are enamored of youth in this country, and having the hair brought back is going to gain you some years back. If you're 55, you're going to end up looking like you're 43 or 44, and that makes a big difference in how people can perceive you, whether you're giving a presentation in public or even in a private meeting, one-on-one with a client. People look at your hair and they're going to say, "Wow, you look so refreshed today."
Yeah. So everything matters. It's just like clothes. It's perception, and it's not like we're giving you something you didn't have. A lot of men are always like, "Oh, I can't do that. That's being vain." Well, when you were growing up, you had hair up here, right?
Yes.
So I didn't give you anything. I didn't pull something out of a drawer and insert it in your head that you didn't have, right?
Correct.
So between you and me, I think guys should get over it. You can have excellent results, and this is just proof positive of what we can do. Here in Chicago, the days of plugs, scars, all those other things are over. We take what we do very seriously, and I think I'm a master of my craft, and every patient that we have, we will do everything to make sure that the outcome and the results are just fantastic. So the reason Neil is here now is because everybody wants thicker hair. We're going to do some more grafts, thicken up this mid scalp and this front to just give him more density in here, just to make it look better. Does he need to do it? No. Does he want to do it? Yes. Everybody does. I've had several hair transplants myself, and I'm always tweaking my hair. So this is Dr. Yates in Chicago. Hope you'll come see us. We're right in the middle of the country, so there are no excuses. Thanks.